Let's turn to Dr. Peter Slavin now. Dr. Slavin is the president of Massachusetts General Hospital, and this week, along with Senator Ed Markey, he called for a modern Manhattan Project to combat this virus. Dr. Slavin, good morning to you. And I thought of you yesterday. I saw you on Meet the Press on Sunday, and yesterday in the United Kingdom, it was announced that I believe Rolls-Royce and Land Rover, they're going to cut back on producing automobiles, and they are going to turn to producing ventilators instead. Dr. Slavin, why can't we do something like that in this country right now?
Well, I think it's already beginning to happen. I was very pleased that the president signed the Defense Production Act a few days ago. I certainly hope the administration will use it fully. But we've already heard from people around the region, around the country, that are trying to convert their businesses to businesses that can manufacture healthcare products, and also individuals who are sewing masks and doing a variety of other things. It's really going to take the compassion, the energy, the imagination of the American people to get us through this. And I have no doubt they will rise to the occasion.
Speaking of those masks, you put out an urgent call for more PPE, personal protective equipment, masks, gloves. How is that going so far? Have people responded to the request that you made earlier this week to send more?
People have responded. I mentioned to a local NBC affiliate that in Italy, a company used 3D printing to make N95 respirators. I must have heard from 100 different individuals, companies yesterday who have 3D printing capability and desperately want to help. That's one idea. I'm sure there are many others. We also have heard, for example, that the masks used in the construction industry are suitable for healthcare use, since most construction projects have been shut down, certainly in this city and I presume around the country. We need the construction industry to get those masks into the hands of healthcare providers.
Let's talk about Mass General here for a moment. At last check, I believe last night, there were about 328 cases of coronavirus there in Massachusetts, 8 at your hospital. I understand more than 100 other tests are out, so the number could be much higher. How quickly do you expect the numbers to rise there at your hospital? How prepared is Mass General?
The numbers are roughly stable overnight. We're prepared. We're currently dedicating 3 inpatient units to the care of those who need general care. We have a few patients in the intensive care unit. We have plans to potentially double our intensive care unit capacity from 150 to 300. We certainly hope we don't have to put those plans in place, but those plans are ready to go. We want to plan for the worst and hope for the best.
Let's talk about what just happened in California overnight. This idea that states should consider sheltering in place to help flatten the curve. Where do you stand on that? Is that something that other states should be considering as well?
I think all states, cities, and towns should be considering drastic, I know what people refer to as social distancing measures. I prefer the term physical distancing. It seems like we need more social connections than ever before, but it's physical distancing that I think more accurately describes what we're trying to achieve. I think the right answer is probably not the same in all parts of the country, and I think public health officials, public leaders need to make the best judgment about what makes sense for their community, but certainly it's better to err on the side of caution.
Really quickly, let's talk testing for a moment. Of course, there was a promise earlier this week and last week that more testing kits would be made available. You're on the front lines. Have they made good on that promise? Are you getting more tests?
We have seen a dramatic increase in testing here in the Boston area, thanks to the efforts of Governor Baker and others. Hospitals have started to bring on testing, including ours and our colleagues at the Brigham and Women's Hospital. Commercial labs have entered this space, and the state continues to do laboratory testing through the Department of Public Health. The biggest challenge at the moment is the turnaround time. We have over 100 patients in the hospital waiting for their results. They all need to be in the hospital because of the severity of their illness. But if we found out that many of them were negative, we could take them off of these precautions and conserve personal protective equipment. So getting these tests, not only having them available, but getting them the results quickly would be enormously helpful.
Dr. Slavin, last question here really quickly. Our doctors, our nurses, our first responders, those folks who are on the front lines there at your hospital, how are they holding up?
They're holding up very well. I mean, I think there's everyone's adrenal glands are producing lots of adrenaline. There's a certain amount of excitement in the air. There's also a strong sense of determination that we're going to get through this on behalf of our patients and support one another. But I also think there's a fair amount of fear. Healthcare workers are being put in situations where they could endanger their own health. That's why we need this PPE supplies to last as long as possible. It would be unfortunate if healthcare workers found themselves in a position that they had to treat these patients without the protective equipment. It would be like sending soldiers into war without helmets or armor. That would be a tragic situation.
Dr. Peter Slavin, Mass General. Dr. Slavin, thank you so much, sir. Thank you very much for that. And we will be right back here on the third hour of Today.